Hi, everyone. We are here with the VProject to talk to you about the COVID vaccine. And I am Jessica Molina. I'm the principal of Escuela Smart. I am here with Sabina, Serratos, and Dr. Paat. We've all been doing some work on the south side of Toledo specifically. So before we dive into that, I am going to let Sabina and then Dr. Paat introduce themselves.
Absolutely. Thanks for joining us, everyone. Thanks for having us. VProject, like Jessica said, I'm Sabina Serratos. I serve as the executive director at Adelante, the Latino Resource and Community Center here in Toledo. I'm also a lifelong resident of South Toledo. So I look forward to the conversation that we're going to have.
Hi, everyone. My name is Dr. Richard Paat. I'm an internal medicine physician. I'm a professor of medicine at the University of Toledo. I'm with McLaren Health, internal medicine there, and I run the community care free medical clinic. And I bring 5 COVID vaccination teams around Toledo every week.
So Dr. Paat, I feel like that's a very, very humble way to describe what you do. And I want to ask you to give a little bit more detail, like where are the clinics, about how many people are you serving each week, and just give us more about what specifically you're doing.
Okay, sure, thanks. So we've been partnering with organizations that we've worked with over the last decade. And when COVID hit, we had natural partners. So one was Flock. We work with them in the migrant camps every summer for the last 12 years, and with Valdemar. And the big need to improve the rate of vaccination amongst the Latino community made perfect sense. So we started there in the end of January, and then we moved over to Escuela Smart, 3 weeks ago now? I think 3 weeks ago, which is great. It's more space and we can vaccinate more people there. We're vaccinating about 200, 250 people on Friday evenings from 6 to 9. And then we're also at St. Peter and Paul. So we were at Immaculate Conception every Sunday and St. Peter and Paul, but because the age rates decreased and the time between the masses were so close, we moved everything to St. Peter and Paul. So we're there every Sunday from 1:30 to 4:30, and we're vaccinating anywhere between 200 to 250 there. We do some other clinics. We're at St. Louis Helping Hands in the parking lot on Monday evenings. We just started a homeless clinic there. Small numbers because of the population. It's more difficult to get a homeless population there. So between 20 to 40 per night on Mondays. And then on Tuesday nights, we're at Tabernacle Church, which is off Pinewood. We're there with Pastor Sweeney and Christine Sweeney. And we vaccinated about 200 to 250 there. And then on Thursdays, we're at our community care clinic, which is at Cedar Creek Church on Burn Road. And we've been running a free clinic there for a long time. So we started vaccines there, and we're hoping to ramp up to about 200 per night. We get our vaccines from the health department, and our free clinic now has official status with the Ohio Department of Health to get vaccines directly.
Thank you for that. So you're doing this 5 times a week in various locations in Toledo. A lot of them are on the south side. Rachel, I'm going to read them to you just in case you can put them in the chat so that people can see these days. And then I'm also going to give you the phone number that people can call to set up an appointment. So, and correct me if I'm wrong when I say these, Dr. Paat. On Sunday, you're at St. Peter and St. Paul. On Monday, you said St. Louis?
St. Louis Helping Hands in the parking lot.
St. Louis Helping Hands. On Tuesdays, you're at Tabernacle Church.
Yes.
And on Thursdays, you're at Cedar Creek, and that's the one on Burn Road, right? Or
correct.
Okay. And then Fridays, you're here at Escuela Smart for the partnership with Flock.
Right.
And then the phone number, if anyone listening is interested in calling to set up an appointment, the phone number is 419-318-2191. And before we got on this call, Dr. Paat, you shared the great news that at least this Friday at Escuela with Flock, we are vaccinating 18 years and up. Is that correct?
Yes, we have Moderna vaccine, which allows us to vaccinate anyone over 18. And the governor yesterday released that if there are extra vaccines, extra appointment times, go ahead and start 18 and over. That was officially supposed to start Monday. Right now it's still 40 and over, but we're going to be able to start vaccinating 18 and over on Friday.
That is so great. Thank you. So I'm going to go to some questions that I have for both of you, both Sabina and Dr. Paat. And we talked a little bit about this with Dr. Paat. So I'm going to start with you, Sabina, and then Dr. Paat, if there's anything related to it that you haven't yet shared, if you could share it at that time. So Sabina, my question for you is, considering the community you serve, so maybe give us a little bit more background about the community you serve. So considering the community you serve and the work that you do, how would you describe your current or our current situation with COVID?
Sure. So the community and the community that I serve and in the capacity that I sit from my vantage point as the director of Adelante, and of course, where I live in South Toledo, I would venture to say that we primarily serve the Latino population through our various contacts and things like that. So when it comes to, I guess, the progress that we're making and what we're doing, we've been fortunate enough to be involved in the VProject. I think that's a huge effort. I feel like we've come together as a community. Lots of folks are around the table, and when I say lots, I'm talking like hundreds, that we've developed a plan to be able to reach out to the community in a way that nobody gets left behind, right? And so from Adelante standpoint and my South Toledo resident standpoint, we serve to be a conduit for that information. For instance, Dr. talked about the clinics that are out there. We have staff members that are volunteering to go after hours and on the weekends to volunteer, because it doesn't just take somebody, you know, to put the vaccine and give the shot in the arm, but there's a whole process, and it's a magnificent process, right? Where people have to register, they have to arrive, they have to sign in, and all of that good stuff, where lots of help is needed. And so we serve in that capacity. And I don't think that we're alone in doing that. I think there's various entities that also do that. What helps us stand out, I guess, when it comes to the community that we serve, is that our staff, they're Latino. And so sometimes there might be a language barrier, of course. And so our staff is there to serve in that capacity as well, to help folks that have their first language is Spanish, that they'll be able to communicate via the paperwork, whatever needs to be filled out, or where to go next, and answer any questions that they might have. So that's one way. I feel that we've really come together as a community at large with the leadership of Dr. Paat. I don't think that we would be able to meet the needs of our people. And when I say that, the Latino community, for various reasons, without the help that we've been able to hear from Dr. Paat. When he's known in the community, he's known for having the community care clinic and out there and helping those, especially the undocumented population. And so trust is huge with the population that we serve. We've got to be able to educate them first and foremost, but that trust factor has to be in place in order for us to get them there. And I think that we've done a really good job with that. I think that along with word of mouth, having discussions, talking to them about, their fears, the myths, the facts, all of that good stuff, we have to be able to show them via commercials, billboards, material that they can read in Spanish and things like that. And so coming together to talk about those needs and making sure every stone, doesn't go unturned, that we've done that. We've done a good job in communicating that with each other. And so along with the meetings, we meet with subcommittees on the VProject, we meet with the overall committee, and we're staying informed and we're sharing. I think with Donnie Miller heading up the Minority Health Subcommittee, and I'll use that as an example, it's one of the ones that I sit on. We talk about the various things that need to happen in order for the Black and Brown community to be able to receive that information. And so educating each other, and being that voice and advocating to make, to ensure that everybody is receiving the information at the same time, is one of the things that we do as well.
It sounds like, I mean, I know Adelante, my heart goes out to Adelante. I've worked there before too. And I know that you do so many things. You're a nonprofit that has so many different programs. And it sounds like now that we have our COVID crisis, it sounds like a lot of your responsibilities, you're still doing those. And in addition to doing those, you've also have this other lens of how do we reach the community in light of this pandemic? Is that true?
Absolutely, absolutely. Adelante is one of the, I mean, we're a nonprofit. We're not a very large nonprofit, but we've, the reinforcement of the need for such an organization was very evident, if never before, throughout COVID. And the reason is we were considered and are considered essential. Our doors had to stay open. Our phone lines had to stay open. We had to stay in place in order to serve the Latino population that looks to Adelante as the hub. And so from the start of COVID, we've not rested. None of my staff has rested. We've been here. We know the need is there. There can't be a time that we can't answer the phone in order to be able to help folks. So when COVID started, the questions started, surfacing. Where do I go for things as simple as, the Clorox wipes? Shelves were emptied, in the Walmarts and the Krogers and every store that you can think of. The Latino population, we may have a population that says, hey, I clean with bleach and water, and that's what I was taught, and that does the job for me. Now the CDC is coming back and saying, no, in order for your family to be completely protected, you have to go get the Clorox wipes. You have to disinfect with this, such and such spray. So those are some of the things that we had to answer and calm the fears of those folks early on. Even though we weren't in the know, we had to, come together to think outside the box to be able to help them through that process as well. And one of the things that we did is we provided care packages to the community through the help of the Toledo Community Foundation. We were able to serve over 113 families by making Clorox wipes because they weren't available at the stores. We got the little concoction, we made it. We printed up the directions on for them to make it themselves. We made Clorox, or not Clorox, but the sanitizing wipes for them and the disinfecting spray, which provided them with the cleaning materials that they need, but it also gave them peace of mind. So things like that from the start all the way through now. Our hats we're still wearing the same hat of serving them in that capacity and meeting their needs, but we're also encouraging them and educating them and trying to get the word out to them how important it is for the vaccine and why they need to look at the facts of the vaccine and trying to, squash some of the fears that they still may have about the vaccine. So you're absolutely right, Jessica. Thanks for pointing that out.
Yeah, of course. I mean, your ability to pivot and provide your current resources while also pivoting is a testament to you and the Adelante staff. So thank you. And I see them at the clinic, and Dr. Paat sees them in the clinic as well. And they are critical and crucial in breaking down that language barrier, which I'm going to say the clinics again where you're located, Dr. Paat, so that Rachel can get them on the chat. We have St. Peter and Paul on Sundays. On Mondays, you're at St. Louis Helping Hands. On Tuesdays, you're at Tabernacle Church. On Thursdays, you are at Cedar Creek on Burn. And then on Fridays, I have the pleasure of hosting you here at Escuela Smart with Flack. And then Dr. Paat, I'm going to ask you the same question, just in case you want to elaborate a little bit more that I asked Sabina. And the question is, considering the community you serve and the work that you do, how would you describe our current situation with COVID?
Yeah, I mean, COVID sees no boundaries, right? But within the Latino, even the Black population, it disproportionately affects us. They have a 2 to 3 times higher risk of getting COVID, of getting hospitalized and dying from it. So in that regard, the population is at significantly higher risk. I'm an internist. I take care of COVID patients in my office in the hospital, and to see somebody die from COVID is horrible. And within the Latino population, I mean, it is astounding how many people are getting hit by this. I talked to Father Molina when I asked him if we could start bringing our teams out to St. Peter and Paul, and he said, yeah, you know, I had to do 4 or 5 funerals this weekend from patients that passed away from COVID. You don't see those kind of numbers in the white population. And obviously there are reasons for that. Lower income, less ability to access healthcare is certainly there. If they have COVID, then they might not get seen in the beginning part. They might get seen when they're really sick and therefore end up in the hospital on a ventilator and pass away from it. So there are other reasons for COVID to have a higher rate in the Latino population. But you know, my work has always been working with communities that need more help. We've done a lot of international work as well, and you know, I'm very proud of what our medical students are doing, our pharmacy students, our University of Toledo nursing students, and stepping up to the plate and helping to tackle this problem.
We're certainly making progress.
Yes, we are. Dr. Paat, you said that COVID disproportionately affects the Black and Brown community, and I'm going to put a link in the chat. Rachel, if you could end up putting it over in Facebook, because it has the numbers there. So, I mean, that's very much based in facts. Pat, we had a question from Facebook. It came to us from Nikki, and this seems very doctor specific. So I'm going to ask you as opposed to Sabina. The question is, if you've had COVID, should you wait a certain amount of time before getting the vaccine?
So once you've had COVID and you're symptom free, okay, no fever, cough, shortness of breath, typically you're no longer considered contagious if you haven't been hospitalized 10 days after you develop first symptoms, and 20 days if you've been hospitalized. But once you no longer have symptoms, you can actually get the vaccine. There's one caveat. If you had COVID and you received IV monoclonal antibodies to help fight it off, or convalescent antibodies. So somebody else had COVID, they donated their blood, and then you got COVID and in the hospital, you got that blood transfusion to help fight off COVID. If you received any of the antibodies, then you have to wait a full 3 months, because the antibodies might fight with the ability of the vaccine to work properly. So yeah, we've gotten that question a lot of times. Bottom line is, as long as you have no symptoms, except for the very small number of people that received IV monoclonal antibodies or convalescent antibodies.
Yep, and having worked with the process, I know Nikki or anyone who this applies to, if you were to sign up for the vaccine, that would be a question that they asked you. So that would be a question here at Escuela Smart, we do it in person. So you have a medical worker sitting in front of you asking you the question to make sure that you are eligible for the vaccine. And I know also with other clinics, you could answer that question online possibly. So it is something that the doctors and the medical screeners are all paying attention to. I am going to go on to my next question. Oh, and this is also Dr. Paat specific. So Sabina, I'll ask you the next one. The question is, can you explain the 3 different vaccines and the pros and cons of each?
Sure. So the first vaccines that came out were Pfizer and Moderna, and those came out in December. This is a new technique. It uses something called mRNA, messenger RNA. It's been around for a while, but this is the first disease that it's really been applied to. And rigorous testing, went through all the phases, it received emergency authorization by the FDA, which means that they feel that it's safe and it's effective. And bottom line is both those vaccines actually work very, very well. They have about a 94-95% efficacy, which in the vaccination world, that's really good. We would have been happy with 60%. But to get something 94 that works 94-95% of the time, that's great. The vaccines are different in just a little bit. One is that the Pfizer vaccine requires a second shot in 3 weeks. The Moderna requires a second shot in 4 weeks. And again, they both work very, very well. In terms of storage, that's not so important for the patients, but for the people handling the vaccine, it's a little bit more cumbersome. With the Pfizer vaccine, it has to be kept colder. Once it's out of the freezer, it's only good for 5 days. The Moderna vaccine is good for 30 days. New out in the horizon now is the Johnson & Johnson vaccine. So that came out, and that people are waiting for that one, including Sabina, because it's a single dose vaccine. The studies for that one, it came out later than the Moderna and the Pfizer. And so in the meantime, while waiting for that, the vaccine's pretty smart. It made variants. So there are variants that came from the United Kingdom, from South Africa, from Brazil. There are variants from California and New York. And the virus changes and becomes, these new variants are probably a little easier to, now it's easier to get COVID. It's more communicable, and it may be even deadlier as well. So the Johnson & Johnson vaccine came out of the time when these variants are coming out. And when you look at that efficacy around the world, it's 66%, but in the United States, it's 72%, which again is still great numbers. You know, we don't want patients to say, well, this is 72% versus 94, 95%. You know, I think I'll go with a 94, 95%. Again, the nice thing is it's single dose. They are looking at other studies, you know, should a second vaccine come out, should a booster shot come out later on, but right now it's single dose. They all do what it's supposed to do: keep the patients out of the hospital, keep them from getting on a ventilator and dying. So, I mean, you may become an asymptomatic carrier, you still might get it, but you're not going to get sick from it. And I mean, that's the important part. I'm not sure what the numbers are now, but it's at least 550,000 people have died in the United States. And that's what we're trying to prevent: keep them out of the hospitals, keep them alive.
If I'm hearing you correctly, the efficacy rate ranges from 72% to 95%, but what you're also saying is that percent might actually not be that big of a deal. What's most important is that you just get one of them, because they all do the job that needs to be done.
Right.
Thank you.
In our clinics, we've been seeing some patients that are saying, well, I'd like to hold off for Johnson & Johnson, or I'd rather have Moderna, or rather have Pfizer, but we don't have that luxury. When we get the vaccines from the health department, or if we order them from the Ohio Department of Health, they give us one, and that's what we dispense. So the best thing is get the vaccine, whatever vaccine it is, as soon as you can.
Thank you, Dr. Paat.
Sure.
Sabina, you ready for your question?
Ready.
As many people are hesitant to get the vaccine, why do you think that's the case? And in what ways do you empathize with their reasoning?
Yeah, absolutely. I think first and foremost, it's the fear of the unknown. I mean, let's face it, COVID-19 hit, and it sent us all in a world, right? We don't know what we don't know. And so I think that for the most part, they don't know. A lot of folks question, you know, how quickly the scientists came up with the vaccine, when it's taken years and years for other vaccines to, you know, be created. So I think first that would be one of the first reasons people would say, like, well, they came up with it too quick. I'm not going to be a guinea pig. I'm not going to be, you know, I'm not going to be the one that they're going to take the test on, or what have you. And some people say that jokingly, but a lot of people, it's real. It's what they feel, it's what they think. And so they're just not sure. So I would have to say that. I think long-term effects are something that people have talked about, like, well, what is it going to do for me long-term? You know, it might help me now, but what about years down the line when they realize how quickly they came up with it? What do I do at that point? Some have stated, I don't believe in vaccines, period. You know, and so why would I go ahead and I'm just gonna go with the flow and hopefully, you know, make it through it. While some have compared it to getting the flu shot. So the flu shot was the same thing. I don't get it, and I choose not to get it because it's gonna get me sick. I don't want to be sick. Once I get the flu shot one time, I was sick for a week. I was sick for 2 weeks. So of course, they compare that. But I also think that the side effects that people talk about, and we've seen that, we see some of that to be true. And I think with many vaccines, there are side effects that people just are afraid to deal with, whether it's going to be short or long term. The fear is there. And so I really think that all of them, all the above, they're legitimate. They are legitimate. We have to listen to them. But that's why it's even more important for us to be educated on the vaccine and share that education with them. And so it allows them to hear from different folks, and so they make the best sound decision. But I think that I empathize with their reasoning because even people in my own family, I shared with you all. I mean, it's just the fear of the unknown and not knowing and taking that first step until it hits home. We had my Theo was really sick in the hospital, and we were praying and giving. And today we give all our glory to God. Of course, we also know science has something to do with it because he was treated at the hospital, but he's very sick. And so when the reality hits you that this is all COVID-19 related, and maybe the vaccine would have helped, then maybe I might give in a little. So I empathize completely with them, but I also encourage education, read up on it, become very aware of the science, not the myths, the science that's out there, and take a look around. I mean, when one night I just sat back and I thought about all of the people directly and indirectly that I know personally, some who lost their lives. One of my sister's childhood friends left behind 5 children. She's Latina, and the only, they don't have a male figure in their life, a father figure. So 5 children, a mom, and their grandma, which is her mom. One of them passed away on a Saturday, and the grandma died on a Sunday. Those 5 children lost their entire support system in the matter of a weekend, right? That hits home. That makes you realize, and it forces you to think, how quickly this can happen and how important vaccination, can save lives, right? How it's going to save lives. And so if you think about the number of people that we know here in Lucas County, our neighbors, our extended family, our friends of friends, and many of them have lost their lives. It doesn't take a long time to figure out why you need to be an advocate for the vaccine. And at one point I did say, what do you have to lose? People are dying. People are getting sick and they're dying. So without the vaccine, you have more to lose than to get the vaccine and protect yourself. Even if it is, 75% to, it's not 100%, it doesn't matter. It's still something in place to protect us. So I completely empathize with them, but I also encourage them in a way that educates them and pushes them to read up on the vaccine.
Yeah, your story, I mean, that is just in itself a heartbreaking reminder of why this vaccine is so important.
Absolutely.
Thank you. Dr. Paat, I'm going to ask you the same question. I will say very transparently, we know everyone here thinks that it is so important to get the vaccine. And like Dr. Paat was saying, any vaccine that you can get as soon as you can get it, that's the best one. I think I heard you say that that last weekend, Dr. Paat. I said, which was the best one to get? You said the first one you can. So while I ask you this question, I also just want you to speak to, the people who are hesitant to get it. And what would you say to those people, Dr. Paat?
Yeah. Initially, and I'll borrow a phrase from Valdemar saying, initially when the vaccines came out, the push was to vaccinate the elderly because they're the ones that are at high risk for dying. And so Valdemar said, yeah, let's vaccinate abuelos, and then they keep them alive. And then you can see, and then everybody else anybody that's younger will say, yeah, there's no problem with this. Let's get vaccinated. Because you don't want your grandmother, you don't want your grandfather to pass away from this. So the hesitancy, at our clinics, I do see some patients that come in and say they've actually signed up, they filled out the forms, and now right before the shot, they say, hold off. I'd like to hold off. And said, okay, if you have any questions, ask me. I'm here to provide answers. You can look it up yourself, or you can ask me the questions, or anybody here, and we'll provide the answers. And when you're comfortable to get the vaccines, then come on in. We'll, if not this week, the next week, come in and get the vaccines. But educate yourself, and don't go on Facebook and look at the myths and everything else. Go look at the data, because all of the science, all of the research shows how safe these are. There have been millions and millions of doses now that have gone in people's arms. There's no deaths from this. The only issue might be a little ache in the arm, or a little low-grade fever, or a headache, or a muscle ache that might last for 1 or 2 days, and then it goes away. And it sure beats, catching COVID and dying from it. Or not only that, just dying from it, but long-term complications from COVID. I mean, 25% of patients have long-term complications. They're alive, but they're still suffering from COVID. I've got one patient that every time she smells coffee, she smells burnt tires. I've got another patient that can no longer teach Spanish in high school for the last 3-4 months. She has a brain fog and can't put it all together, and hasn't been able to go back to teaching. And I've got other patients that continue to have headaches or fatigue symptoms. My wife's cousin is living with us right now after suffering from COVID, and it's difficult for her to climb up a flight of steps before she still gets short of breath. I mean, those are long-term complications of COVID that people still have to put up with. It's not just dying; it's a long-term complication. So, if there's hesitancy, okay, we're here to help get you through that, to educate you. And when it's your time, step up and then get vaccinated. And the important thing about the people that are getting vaccinated now is they become the ambassadors. It's the abuelas, but now the ones that are 50s and 60s. And once you get the vaccine now, other people that have been hesitating, saying, well, I don't want to be the first one. You're no longer the first one. Your friends have done well. And that's, a lot of studies are showing that. It's not so much the education part that is keeping patients from becoming hesitant, but once they know somebody that's gotten the vaccine and they've done well, now they're more agreeable to stepping up and getting the vaccine themselves.
I enjoyed that you were talking about, or I love how you address the long-term effects, because one of the things that Sabina said was that is one of the reasons that people are hesitant to get the vaccine. They're hesitant about getting the long-term effects from the vaccine. And what you're saying is, if you take the risk to not get the vaccine, you may end up having long-term effects from COVID. Is that correct?
Yeah, exactly. Yep.
Yeah. And then something that both of you guys touched on was just being educated about the vaccine. And I do have to use that as a little plug to share the VProject page. If you're watching this, you might be watching it from the VProject page on Facebook, but you could also search VProject Toledo, and then also go to Lucas County Health Department. And both of those websites will show you, give you information about the vaccine, where to get it, but also it will debunk some of the myths. So if you feel like you're on the fence and you want to do some of your own research, please go to the Lucas County Health Department's webpage, as well as the VProject webpage. So the next question I was going to ask you, I feel like we've already addressed, but for the sake of being super clear and providing any more information on it, I'm going to ask you anyways, and it is, what is your stance on the vaccine and why? So Dr. Paat, you're unmuted. I'll let you go ahead and go first.
We are very pro-vaccine. We haven't seen any real contraindications unless you have a history of anaphylaxis against other vaccines. Obviously, I think that everybody should get the vaccine. You can't get back to your normal life as it was until we get that herd immunity. So a minimum of 70%, but if we can get up to 85%, even better. We know we're not going to get 100%, but once we get that herd immunity going, then you can get back to some semblance of normal life again. The vaccine, 85% of the people would be vaccinated, and you have such a decreased chance of that vaccine spreading from person to person that hopefully it won't continue to mutate and make things worse here. So I think we're all tired of wearing masks. My parents had COVID and then they got vaccinated, and I was vaccinated. And once the CDC guideline says that once you're vaccinated, you can do some things again. So I was able to hug and kiss my parents for the first time 3 weeks ago. So there's still some travel guidelines, travel restrictions, but things are going to open up once you start getting the vaccine.
So you said once 85% of the population is vaccinated, that's when we can start looking at returning to normal life, or you said herd immunity. Can you clear that up for me?
Yeah, so herd immunity is that if everybody is protected, has had the vaccine, then the COVID virus can no longer spread from one person to person by just sneezing, by touching. And so you need at least 70%. 70% of the people have to have some sort of immunity to COVID. And the best way is through the vaccine. And a minimum of 70%. If you can get even higher to 85%, then all the better. But until we hit that amount, the vaccine is going to continue to spread within our community. It's going to continue to mutate. It's going to continue to become easier to catch and deadlier. So the faster we get the vaccine into people's arms, the less chances of the vaccine to mutate, and the faster we can get to that 70%, 85% above, and get back to our normal life, which I think is what we're all itching to do.
You were talking earlier about how those of us who have been vaccinated, we can be like the walking advertisement for our friends and families. And those numbers that you just shared, I'm like thinking, okay, so now I need to get 85% of my friends and family vaccinated. Sabina, I'm going to ask you the same question. I think you also shared it a little bit in your response, but just in case you want to elaborate more, what is your stance on the vaccine and why?
Absolutely. So much like Dr. Paat, I am pro-vaccine. I am pro-vaccine with the caveat of education. You have to be comfortable in knowing, what's out there. A lot of folks have asked, well, what's the difference between the three? I think this is valuable that we have Dr. Paat to share that with us, because that is a common question. What is the difference between the three of them? Why would I choose one over the other? And, so on and so forth. So I think education is key, but again, we cannot return to any type of normalcy if we don't reach herd immunity. And the only way to reach herd immunity is if we're all on board, and the more people on board. And so when you get to see somebody, well, not just somebody, but many folks, firsthand suffer from COVID, lose a life from COVID, not being able to kiss or hug your parents or your loved ones. And in my case, I have 2 grandbabies who were born prematurely. They're going to be 4 years old this year, but getting them sick or having anybody around them that is not immune to COVID-19 is always going to be on my radar, right? I'm always going to be very protective of them, and how many other people are going to feel like that, as we should. And so I'm very pro-vaccine. I just think it's very important that folks do educate themselves and make the best decision for themselves as far as which one. It's not about do it or not. It's about which one is going to work for you or you're comfortable with. Because once we start, like I guess, having a conversation about forcing it out there, that's never going to be in my vocabulary when it comes to the vaccine, only because I want people to realize how important it is. And you can come to that conclusion by educating yourself. Again, there are so many examples that are just so sad over the past year, the number of people that we've lost that should be still living vibrant lives right now. The vaccine could have saved them, right? Had they had the vaccine, if it was available. So don't let that pass us. Don't let us stay stuck where we are right now, with not being able to see our loved ones, without being able to have gatherings, to to not being able to do the things that we've taken advantage, or we've I guess the term I'm using for is we got used to it, right? You don't think how valuable relationships or being around each other or things like that are until you can't do it anymore. Going down to the we taken for granted. Going down to the Mud Hens to see the games, every baseball season. Oh, how we miss that, right? Things like that. But even the simpler things of like being around family, we won't be able to get to that point until we reach herd immunity, and we need to spread that message with education. So.
Yeah, it's almost like you were saying that you didn't want to force the vaccine, and it made me think of the opposite, which I'll talk to that in a second too, but it made me think of the opposite. There are so many people out there who want normalcy, but it's like we can't force normalcy unless we get the vaccine, unless we build this herd immunity. So people can want normalcy to come back, but it's not going to come back without the vaccine and without all of these precautionary measures that we have to do.
Absolutely.
And then Sabina, I also heard you say that it's almost like you recognize that there's hesitancy to get the vaccine. And so even amidst that hesitancy, you would say, okay, so just you have three options. You have three options for the vaccine. And if you are on some sort of scale, why don't you at least look into them?
Absolutely. Yeah. Oh, yes. The encouragement will always be there. I will always encourage it. And I have, the thing with me, like I shared the one story, those are real, those are raw, those are real lives that have been impacted. And I always, if I have somebody who is like totally against, without having any information, without having the facts that, or even taking the time to look at the CDC website or hear somebody out, then I revert to sharing the stories that we know that, we've had prayers outside hospitals, local hospitals for family members that are in there fighting for their lives, and we can't hug them. You know what I mean? So I always revert back to you. Do you want to be in that situation? Do you want your family to be in that situation for you? Because sometimes that's what it takes. Those simple conversations that opens their eyes. But yeah, so I will always encourage, and one of that is the three. Which one will you choose?
Yeah, and I know, again, I'm thinking back to my conversation with Dr. Paat. I don't know if it was last weekend or the weekend before, but when I asked him which one was the best, and he said, anyone, just get one. So Dr. Paat, what research do you think is out there? Is there anything in addition to the CDC that you would point out to somebody who wants to do more research?
Yeah, I mean, the Toledo Lucas County Health Department has frequently asked questions part. The Ohio Department of Health has the same thing. You can look at any institute, Mayo Clinic, Cleveland Clinic, University of Toledo. You can check any of them out. I mean, the science is all there. It's very, very supportive of the vaccines, how safe it is, and how effective it is. And now the studies are coming out showing that yes, the vaccines are decreasing the rate of people getting COVID. It's definitely improved our the hospitalization rate, the death rate that we're seeing. I think right now in Lucas County, the state of Ohio, we're at 25% vaccination rate, and so we still got a ways to go. We'll keep punching away. Our teams will be there 5 days a week, helping out in the communities. The Toledo Health Department has been a wonderful ally with us in making the vaccines available to communities of color. They've set aside 20% of the vaccine allotment, and we're getting more and more. I just picked up 800 vaccines today from the Lucas County Health Department. Thanks very much, Eric and Eileen and Dave, for that. The vaccines are going to keep rolling out. Johnson & Johnson will be kicking out more and more. There may be another vaccine out in the horizon, AstraZeneca, that still has to go through approval, the approval process. That probably won't get to us until May. I mean, it'd be great to have another vaccine out there, but through the Biden administration, the big push has been really to make the vaccine available. They're Biden's goal was open it up to everybody May 1st. We're opening it even sooner. We're opening it up starting Friday for us. So
It's going to be really exciting. I'm excited to serve or be able to volunteer with you for a younger crowd.
Yes.
I do have one more question before we go. I know our end time is 6:30. And this question goes out to anybody who's listening that's working with the community or has some sort of role when it comes to serving the Black or the brown population. What do you think our community needs to do and offer in order to decrease the number of COVID cases in our neighborhoods? And I'll let Dr. Paat go first.
okay, so it's doing everything that we've always been doing. It's still wearing the mask. It's still washing your hands frequently. It's doing the social distancing. It's making sure, now that it's getting warmer, making sure that you've got good ventilation in the hallways of the schools, making sure those doors are open and letting air pass through in your house, opening up the windows if you are having a dinner gathering and people aren't vaccinated, getting some if you can eat outside, keeping the distance, getting ventilation. So maintaining all those things, but also making sure that we get vaccinated. For the Latino communities, for the Black communities, it's making sure that they have access to the vaccines. I'm not seeing so much hesitancy. I'm seeing so much more of an access issue. Our teams are trying to do what we can to break down any barricades. Whether it's a language issue, our teams are bilingual. Whether it's an access in the evening times, 4 nights a week, we're out there 6 to 9 p.m. when most people aren't working anymore. We're open on Sunday afternoons if that's what it takes. When we hit this big VProject, big push in May, which is, that's a long ways away, May, but we'll be doing a vaccine marathon at Escuela Smart. So we'll be there 2 nights straight, 36 hours, like a dance marathon, hoping to vaccinate as many people as that are willing to come in. So if you have any questions, if anybody has any questions, just ask. Keep doing the research to educate yourself, but we'll be out there in the communities trying to help as much as possible. There are going to be hopefully more pods popping up in the communities as well. These mobile pods that are necessary they have to be more visible as the vaccine becomes more available. Hopefully the communities, the various organizations, Mercy, ProMedica, the health department will see the need to step out in instead of big vaccination areas. We've been working more within the community with community leaders, trying to make sure that people are comfortable getting the vaccine and making the difference that way.
Thank you. So from a personal level, don't let down your guard, wear your mask, be well ventilated, wash your hands, keep your distance. And then from a community worker level, do what you need to do to make the vaccine accessible to the minority community. Am I hearing you correctly, Dr. Paat?
It's perfect. It's a great summary.
Thank you. And Sabina, I'll ask you too, what do you think our community needs to do and offer in order to decrease the number of COVID cases in our neighborhoods?
Are we there?
We are still here, yep.
What happened?
I'll ask you again, it might have just been a little hiccup.
Oh gosh, yeah, okay.
What do you think our community needs to do in order to decrease the number of COVID cases in our neighborhood?
Yeah, I think that what we've started to do, and a lot of us are around that table in the Latino community, getting the word out and being the advocate and being the voice for our community. I think that needs to continue, even when the discussions get tough, even when the pushback happens as to what we're doing and what we have resources to do and all of that. We need to maintain that, but we also need our community to hear us. We need them. You have the Latino community, the Black and Brown community overall. They have a lot of advocators for them right now around the table, doing what we can on the throughout the day, in the evenings, on the weekends, to make sure that access is happening for them. And so ensuring that we have folks, getting them to the sites, that has to happen too. So if we're doing what we need to do to get the word out and to advocate for access and things like that, people need to be there, right? They need to show up. They need to we have to show the numbers. we're here. I mean, we've got the stats on all of it. But it does seem to get a little frustrating when you're working so hard to get there, and then the end result is maybe next week or something like that. So we have to do, as a community, we have to do our own part, and that is having the conversations with our neighbors, having the conversations with our family and friends and things like that. Meeting people where they're at is crucial. It's key. We have a high population that doesn't have transportation, and so being in the community at Escuela Smart, at St. Peter and Paul, at Flock, all of those are great. That's the type of action that needs to happen. The pods, once they do start setting up, Dr. Pat, that's going to be amazing. And I know that's on the horizon. I know that's in the works. One of the other things that we talked about was for those who are homebound. If we're identifying those folks, and we get the group of folks together, like Dr. Pat's team, that we're reaching out to them and making them home visits. I saw a show on Good Morning America a couple of weeks ago where there's an entire city that's going door to door like that, and that's how they're reaching herd immunity in their communities, and I think that's wonderful. We talked about that early on. But as far as decreasing the number of COVID cases, I think it's a group effort. I think everybody has to, do their part, and know that you have a team of folks here advocating. And like I said, I think I mentioned Donnie Miller and Greg Baylock and the team that we're working under Minority Health. I mean, that's just it is a subcommittee of the overall VProject, but I think that we've made some wonderful strides. And those are the types of things that have to continue to happen for our Black and Brown communities in order for us to reach them. Meeting them where they're at is key.
And I think what you're saying is we need to continue to have these crucial conversations, whether it be in the meetings that we're in to advocate for the resources that we need, or on a personal level with our family and friends who maybe are hesitant. Just keep having those crucial conversations, keep the line of communication open when it comes to the need, the severe need to build herd immunity.
Absolutely.
One more time, I'm going to say all of the places that you're at, Dr. Pat. That way we can get this message out as much as possible and maybe increase the numbers that are coming through the door. So we are serving a lot. I know that each week we are still eager and ready to serve more. So we are on Sundays, you are at St. Peter and Paul. On Mondays, you are at St. Louis Helping Hands. Tuesdays, you are at Tabernacle Church. Thursdays, you're at Cedar Creek on Burn. And Fridays, you're here with Flock at Escuela Smart. And the phone number to set up an appointment at any one of those places is 419-318-2191. Before I wrap it up, Dr. Pat and Sabina, is there any lasting sentiments that you want to share? Sabina, I'll let you go first.
Just reinforcement of the importance of the COVID-19 vaccine, whatever one you choose. We know the numbers that are out there. The Latino community has been severely impacted by COVID-19, and so we need to do our part. Get the vaccine.
Thank you. And Dr. Pat?
Looking forward to working with you guys again on Friday and on Sunday with 18 and over. More vaccines and more arms.
Thank you, Dr. Pat. And then for Those watching, I want to share, there will be another Facebook Live on April 7th, el 7 de abril, aquí en esta página, here on this page, and in Español. Vamos a hablar solamente en Español. So on April 7th, we'll be here in a Facebook Live on the 7th of April on the VProject page. Rachel, is there anything else?
Nope, all good.
All right, thank you.
Thank you, Jessica. Thanks for
Thanks, Jessica.
It
joining
is
us.
a pleasure chatting with both of you, as always.
Thanks, Dr. Pat.
Thanks. Have a good night.
Good night.